voltage gated, and gated just means opening or closing. With action potentials, you typically have voltage gated sodium channels that are going to be open. So for instance, if the physician is trying to deaden a limb to do a procedure like a surgery, he injects you with lidocaine. And the lidocaine actually affects sensory nerves first by inhibiting the voltage-gated sodium channels on the axon that allow the action potential to propagate. So by doing that, the sensory nerve doesn't depolarize and it doesn't allow the pain to reach the central nervous system. So the surgeon or dentist or whomever is able to do the procedure without the patient feeling pain. So you can see the strength of the signal. In the graded potential, it typically depends on the initial stimulus, whereas in the action potential, it's an all or none phenomenon. What initiates the signal? In the case of the graded potential, when that dendrite gets stimulated by whatever stimulus it's designed to detect, then you have the opening of channels, and that can then either be depolarizing or hyperpolarizing. And remember, depolarizing means that the charge inside the interior of the cell body becomes more positive, whereas hyperpolarizing, that charge inside the cell becomes more negative. All right, so if you're looking at a stimulus that goes through the cell body, initially it may be suprathreshold, but by the time it reaches the trigger zone here, if it's less than threshold, then you're going to get no action potential generated from that trigger zone. Whereas if it's suprathreshold, then you do get an action potential generated. And when the action potential is generated, you have sodium channels opening all along the axon that then causes the stimulus to go all the way to the end, and that potentially then causes the release of neurotransmitter to affect whatever tissue is being innervated. It could be another nerve, a muscle, or what have you, even an endocrine gland. So action potentials tend to be all or none. The signal doesn't diminish over distance. And this is a diagram showing what a typical action potential looks like. So typical normal resting membrane potential is around -70. And the reason for that is because cells normally have potassium leak channels. And potassium is the most important ion as far as the resting membrane potential. Sodium leak channels are probably about 40 times less abundant than the potassium leak channels. So the Nernst potential of potassium is normally about -90, and the Nernst potential of sodium is +66. So the -70 resting membrane potential is a balance between the number of potassium channels that are leaking, because normally when an ion channel is open, that's when it affects the resting membrane potential. If that ion is not permeable, it's not going to affect the resting membrane potential. So as we go through it, you can see the resting membrane potential at 1 is -70. When you have the depolarizing stimulus at 2, that then triggers the opening of ion channels, for instance, sodium channels. So these membrane dependent or voltage gated sodium channels open, sodium enters the cell, causing the potential to increase, and rapid sodium entry depolarizes the cell. So once the signal surpasses the threshold at the trigger zone, the action potential is generated, and you get sodium coming in, and then at the peak, we'll see that the sodium channel actually has 2 gates, the sodium activation gate which opens with the depolarizing signal, and the sodium inactivation gate, which closes the sodium channel at the peak, or 0.5 in that diagram, and that then is going to allow the potassium to leave the cell, and that's going to then hyperpolarize and take the resting membrane potential back down to where it was originally. And you actually get an overshoot of that resting membrane potential, but it eventually comes back up to around the -70 region. All right, so you have initiation, depolarization, the signal peaks, and then you get repolarization in that process. So this is a diagram showing the sodium channel, the two gates in the sodium channel. The activation gate is there, the inactivation gate is here. So when you open up the activation gate, sodium comes rushing in to the axon and starts the depolarizing process. At the peak of the action potential, as is shown in panel D, the inactivation gate closes and it allows potassium to leak out of the cell, and the potential starts going down, as can be seen in panel E. All right, so this is just a rehash again of what the Nernst potential is, and this diagram shows the Nernst equation, and the diagram below is just the diagram we just went over. So remember again, the Nernst potential is telling you what information is it giving you. It's giving you typically you're looking at the ion concentrations, which have been set up by the sodium-potassium ATPase. So that keeps the sodium concentration high in the extracellular fluid, the potassium concentration high in the intracellular fluid. So assuming that the gate for the ion that you're looking for is totally open, the concentration gradient causes the ion to move in one direction. Once you start building up charge in that location, you're going to generate an electrical gradient, which is going to push opposite to the concentration gradient. And the Nernst potential tells you the voltage at which point the concentration gradient is going to be exactly balanced by the electrical gradient. All right, and this is actually the GHK equation, or the Goldman-Hodgkin-Katz equation. And you can see that most of the time, the three ions that you have here are the ones that are most important for the resting membrane potential. So you have potassium, sodium, and chloride. And if you notice, the potassium and sodium is the concentration that is outside the cell that's found in the numerator. And on top, chloride, it's the concentration inside the cell. And notice that you also have these permeability terms. So the permeability refers to how permeable the ion is to the cell membrane. So if the ion is not permeable, the permeability is 0, and that term drops out. So the ion has got to be permeable to the cell membrane for it to affect the resting membrane potential. So when you start affecting the permeability, that changes the potential that's found in the membrane and can cause either the potential to get more positive, for instance, if you open sodium channels, or get more negative if you open chloride channels. Remember, chloride is high in the extracellular fluid, so if you open a chloride channel, chloride would move into the interior of the cell. All right, so the reason that you have the two gates in the sodium channel is that with only one gate, for instance, if you only had the sodium activation gate, it would cause a situation where you had a positive feedback loop and you could only depolarize the nerve one time, and the nerve would stay depolarized. By having the inactivation gate close and prevent any sodium from coming in, you allow the potassium to start leaving the cell, and that gives the nerve a time to reset. So some nerves can literally depolarize hundreds of times a second, and you can get signals being generated that can control various different tissues and organs. There's also a period known as the refractory period, and there are two types, the absolute and the relative refractory period. So the absolute refractory period doesn't allow another stimulus to cause an action potential no matter how large it is. Whereas the relative refractory period, it happens after a point so that you've been able to reset enough of the sodium channels to allow the nerve to depolarize again, but the stimulus has to be much greater than it was previously. So it takes a supra-stimulus to get another action potential generated. So when you typically have those two channels, it allows the signal to keep going so you can generate multiple action potentials. If you only had the sodium activation gate, it would literally only allow the nerve to depolarize once. All right, so that's just a summary diagram showing the membrane potential versus the ion permeability of sodium and potassium. And as we said before, at the peak of the action potential, you actually have the sodium inactivation gate closing, which then allows potassium to leave the cell through the potassium channels that have slowly opened. And this shows you the point at which you have the absolute refractory period versus the relative refractory period. And you can see up top the concentration of ions that have opened, and some of them actually reset. So in the relative refractory period, enough of those sodium channels have reset to allow you to generate another action potential with a higher than normal stimulus. All right, so the frequency of action potentials, typically the more action potentials that are generated, the more neurotransmitter that is released, and that allows the nervous system to encode information. We'll see, for instance, muscle typically has a number of signals that go to the muscle to allow muscle tone or some level of contraction to occur. In the heart, also, the parasympathetic nervous system has signals that stimulate the heart to slow down. Normally, if the parasympathetic input wasn't there, the heart rate would be approximately 100. But because the parasympathetic system inhibits the heart from beating faster, it actually, normal heart rate is typically about 70 because of that inherent parasympathetic tone that is present on the heart. All right, so the frequency of action potentials, as is shown here, if you have more action potentials, it results in more neurotransmitter release. And typically the action potential depolarizes the sodium channels and opens them ahead of that ion or action potential, and it drives the action potential to the terminus of the neuron, which then opens both voltage-gated calcium channels. And calcium is higher in the extracellular fluid, so when the voltage-gated calcium channels open at the nerve terminus, it allows the neurotransmitter to be exocytosed. The increased level of calcium causes exocytosis of neurotransmitter, and it's even active in the endocrine system where it allows the exocytosis of different hormones. All right, so this shows that action potentials are all or none, and they tend to depolarize ahead. The action potentials don't travel backwards because the ion channels are in their absolute refractory period just behind the action potential, so that keeps the wave of depolarization traveling forward. So you can see sodium enters, depolarizes ahead. If you give somebody lidocaine, it inhibits the sodium channels there, so if sodium doesn't come into the axon, you're not going to have any stimulus reaching the central nervous system, so you don't feel any pain. And this just shows this region is in the refractory period, but ahead the signal keeps going, so action potentials are all or none, and they send the signal all the way to the terminus. Okay, so the speed of conduction of an individual axon is constant. The larger that the axon is, the more quickly the action potential travels, and also if the axon has a myelin covering, and myelin is a type of fat that literally insulates the nerve and keeps charge from leaking out of the nerve. So there are different disorders like when you have multiple sclerosis. That is demyelination of particular nerves within the central nervous system. So people with MS can have demyelination in different areas of the brain. And depending on what area of the brain is affected, you can have symptoms all over the body. Typically, some of the more common symptoms that people experience are changes in vision, inability to walk, or they have problems with muscle function, in particular, like walking or being able to control their extremities. There are a number of chemicals that block ion channels, like I talked about, like sodium channels, lidocaine, bupivacaine, marcaine. All of those tend to inhibit the function of nerves, so that typically, like when you go to the dentist injects you with lidocaine, it first affects sensory function, but